Having any medical consultation can sometimes feel overwhelming, which is completely normal, especially when you are facing important medical and family and economic decisions. But did you know that this anxiety can sometimes cause you to forget to ask important questions or raise concerns during your appointment with the doctor? This video will help you learn how to talk to the IVF specialist and how to get the best results. Hello everyone, my name is Anna and I'm an IVF patient advocate and medical researcher whose mission is to support individuals and couples on their fertility journey. Today you're going to learn how to prepare a smooth and stress-free IVF experience abroad. Raise your hands if you have closed the door and then at the end of the visit you suddenly find yourself thinking, oh my gosh, when do I have to go for my next checkup? How long is this treatment going to take? Or what is the next step? This is perfectly normal. Your stress hormones are clogging up your brain and your thinking is not as clear as it should be. It happens to us all. It certainly does happen to me all the time. Here are 12 important tips and questions to discuss at your IVF doctor's appointment. So grab your pen and start making some notes. This video is well worth it. Certain medical conditions or medications you are currently taking may affect fertility or the response to fertility medications. By knowing your medical history, the fertility specialist can adjust the treatment protocol to optimize its effectiveness and also increase the chances of success. Pre-exams plays a crucial role in the IVF process, providing important information for treatment planning. Ask your IVF specialist if you have done everything correctly and if there is no need to add any test or repeat any test to check the values once again. Ask about other tests that can help make a more accurate diagnosis and the best treatment plan. Understanding the timeline will help you plan and prepare for each stage of the IVF process. This includes scheduling appointments, arranging time of work when traveling, for treatment and recovery. IVF treatment can be expensive, and knowing the timelines will help you to budget and plan for your costs, such as the deposit, treatment itself, additional lab tests, traveling, accommodation, and so on. Understanding the different scenarios allows you to plan for the unexpected and make contingency plans. For example, if you have an unsuccessful IVF cycle, you may need to consider alternative treatment options, for example, donor eggs and so on, or you may need to take a break before you try again. IVF treatment can be unpredictable. The results can vary from cycle to cycle. Understanding the different scenarios will help you to manage your expectations and to prepare yourself for a range of possible outcomes, including success, failure, or complications. Knowledge of your individual success rate empowers you to make informed decisions about whether to pursue IVF treatment and what approach to take. By weighting the potential benefits against the risks and costs, you can make a decision that aligns with your goals, values, and preferences. Understanding the potential costs and benefit of treatments allow you to make financial decisions that are in line with your resources and priorities. If your individual success rate is low, you may need to consider exploring alternative options for building your family, such as donor, conception, or adoption. Understanding the risk will help you to weigh up the potential benefits against the potential harms and to make a fully informed decision about whether or not to proceed with the treatment. Being aware of the potential risk will allow you and your IVF clinic to take the appropriate precautions to keep these risks as low as possible. This may include adjusting treatment plans, monitoring for complications, and implementing strategies to reduce side effects. Ask what the potential risks and complications of IVF are and how they can be reduced. Ask if there are any particular risks that you should be aware, given your medical history. The decision about number of embryos to transfer should be made together by the patient and their doctor, taking into account both medical considerations and personal preferences. Your doctor can advise on the ideal number of embryos to transfer based on your individual circumstances, including factors such as age, fertility history, and embryo quality, to help maximize the chances of a successful outcome while minimizing the risks. The number of the embryos that can be transferred during IVF treatment is limited by law in some countries. For example, in the Czech Republic, the maximum number of embryos that can be transferred are 2. If you have surplus embryos, decide with your doctor or embryologist whether to freeze 1 or 2 in one straw. If you choose to freeze 2 in one straw, you have to take into account that both of them will have to be used at the same time for further treatment. In particular, at an advanced age, patients should think about how many children they would like to have in the future. For the majority of patients, the focus is obviously on having at least one successful round of IVF. However, if you are using your own eggs, there are age limits and recommendations, so plan your treatment carefully and ask your doctor about the possibility of having another child in the future. The ideal plan is to have the embryos frozen in the cryostorage so that you can use them in the following years without having to go through the stimulation and egg retrieval process all over again. Time is the most precious commodity in IVF, and egg quality declines rapidly after 40. So having frozen embryos from previous cycles can help achieve pregnancy also later. Ask the doctor which supplements or vitamins may be beneficial for you and your partner before and during your IVF. Remember that while supplements may offer potential benefit, they do not replace a healthy diet, lifestyle, and medical care. It's important to discuss the use of any supplements with your IVF specialist, who will be able to make personalized recommendations based on your individual needs, medical history, and specific fertility concerns. In addition, when choosing supplements for IVF, quality control and potential drug interactions should be considered. The financial part worries most patients. IVF treatment is an expensive procedure, and you need to make sure that you know what to expect in order to avoid any negative surprises. The main costs to consider are the fee for the initial consultation, the pre-test and any further tests, the cost of medication and the procedure itself, laboratory techniques, vitrification, embryo storage and frozen embryo transfer. Travel, accommodation and food costs should also be taken into account. Ask the clinic about payment options. Do you need to pay a deposit? If yes, when? Also, when full payment is required. The majority of clinics will ask you to pay all the costs before the egg collection. To ensure you are aware of all your options, ask about payment plans or whether you can pay in, for example, installments. IVF clinics often offer a range of additional services and support to help patients through the whole of their fertility journey. These services can vary depending on the resources and expertise of the clinic and the need of the patients. These may include help with travel and accommodation, counseling, acupuncture, or diet and nutrition support. Having all these under the same roof can be a great help. However, I strongly recommend that you also compare costs and offerings from other providers in order to make an informed decision about any additional service you may need. Thank you all for joining me today. I understand this can be a challenging journey, but I hope this video has given you some guidance and reassurance along the way. For more information, I welcome you to visit my website aboutivf.com, where you will find all the necessary materials and contact details if you have any questions or you need individual support. Whether you're a passive user of my website or actively seek to work with me, you can be sure that you, as a result, will gain confidence and improve your IVF experience. Take care, try and stay positive, and remember that you're not alone. Together we'll travel this journey with hope and determination. If you like this video, please share, like, comment and subscribe. Thank you again, and I'm going to see you with the next episode.